Hello, welcome again. Today we're looking at Mocero Health. So Mocero Health is a health tech company that have been incubated at the IIT Madras, which stands for the Indian Institute of Technology Madras, a very reputed technology university in India. Mocero Health, they're all about digitizing the delivery of healthcare. Now, what aspects of healthcare delivery are being digitized, and what features are being offered by Mocero Health is something we are going to quickly have a overview on. If we go to the solutions tab, I mean, clearly it's evident that they have some sort of a dashboard, which is kind of like a CRM, a customer relationship management, where the patient's primary information, address, and things like that can be stored, recorded, retrieved. They also allow clinicians to store the medical records and retrieve as and when required. However, we yet have to see whether this is a full-fledged EMR or EHR. If we further go into their solutions, this first one, the standard of care. I mean, it's mentioned in the details that they are offering more than 40 customized workflows. So, like for 40 different medical specialities workflows. Now, this is going to be like one of the strongest USPs. I don't see in the developing world an organization which are offering that level of customized workflows. Now, workflows really sort of simplify the delivery of healthcare, and helps the management of the hospital or the clinic to keep a tab on the quality of care being delivered. Having said that, I believe workflows can be a double-edged sword. Rather, workflow automation can be a double-edged sword. I mean, if not done properly, this can really be a pain in the neck for clinicians. That really increases burnout, that turns clinicians into data entry operators, and things like that. But we will have to see what level of workflow automation is being offered by Mocero Health. Further going on, patient engagement. What I understand by patient engagement and what Mocero Health is most likely offering is services like, sending reminders to your patient to come for their appointment, come for the consultation, and things like that. It also possibly allows the physicians as well as the patients to log in and see the progress of the care delivery, whether their lab reports are ready, to keep a track of all that. Possibly it allows individual customers of Mocero Health to run patient education programs, so via videos or blogs and things like that. So that's there in terms of patient engagement. Digitization, now that's really what this company is about. What I understand by digitization, we've previously mentioned, is automation of the workflows. But in addition to this, I believe they're offering things like, sample collection. So, for example, there's a lab. I remember just a couple of days back, I requested a lab to collect samples for my dad, and I had to ring this lab a couple of times. And until this technician arrived at my door, I was a little tensed whether he's going to arrive, whether samples are going to get collected or not. So that's a traditional process. But Mocero Health, I believe they are digitizing this, so it makes it simple for me as a patient to simply log in, either on the website or on the app, and place a request. Now, the beauty of this is this request placed by a patient for sample collection, for example, goes directly into the workflow of the lab or the hospital. Now, this saves a lot of time, money, and speeds up the entire process at the provider's end, at the hospital or the lab end, because this request is automatically fed into the workflow. So you don't need a separate person to take a note of this request, and then hand it over to maybe a care delivery manager. Then this manager has to look into, prioritize, and then hand over to a field technician. All this sort of gets eliminated, or at least partially eliminated. I believe in terms of digitization, they are probably also offering digital payments. I mean, yeah, everyone is doing that these days. Video consultations, so consultation via telehealth and things like that. We'll touch up on this in a bit. Referral management. I mean, this came as quite a bit of a surprise to me, and it's actually a very welcome feature because referrals is something so integral to healthcare delivery compared to any other industry. The sort of, I won't say marketing, but referrals, it happens through word of mouth, really. So there's a physician referring his or her patients to maybe a specialist. The specialist further refers his or her patients to maybe a hospital or surgeon and things like that. So referrals is of such an integral part. It happens really all over the world. So I believe they have some kind of a dashboard where the physicians, they can log in and see, they can refer their patients. They can also see the appointments of maybe the specialists or the hospitals, what hospital is having, how many beds free possibly. I mean, that sounds a bit too far stretched, but yeah, that could be. So there's also one aspect. I mean, that's not necessarily bad. There's always some kind of maybe money getting exchanged or some favors when it comes to referral. So possibly all that can also be tracked in this referral management dashboard. Connected care, very interesting. I think all digital health startups are doing this. So first thing that comes to mind is telehealth. Now I would expect Mosaic to offer not exactly a very advanced, but at least a medium level advanced telehealth system. They also offer, at least that's what's mentioned on the website, and I'm really keen to see the demo of that, is RPM, so remote patient monitoring. Having said that, remote patient monitoring is not something can be done alone by an organization. You need sort of like an ecosystem. So maybe medical devices team, the IT team, and so on and so forth. Of obviously field care team who would go and set up all this at the patient's point of care. So that is something I'm interested to understand how the ecosystem is set up by Mocero. The last one under the services, under the solutions tab, is organ donation. I mean, this came as a breath of fresh air, very honestly, because organ donation, we all would agree, is one of the magics of modern healthcare. Having said that, in the recent past, there has been a bit of bad press for organ donation because of profiteering and things like that. So I assume that Mocero Health here have tried to solve that problem by having some, again, kind of a dashboard where the donors can list, and maybe physicians whose patients need the donation, they that this requirement thing can be matched and tracked in a way. What is very interesting, there's a lot of legal and compliance aspect to organ donation, and Mocero Health, again, it we have to see in a demo, is they're taking care of the rule, the regulation part as well, which really would be very, very helpful to get the stress out of the care provider. Sorry, I had to just pause for a sip of water. If you scroll down, then you can see that they have certain products which are, very nicely branded for certain catering to certain specific specialities. So this one here, Your Sugar, looks like it's a more of a customized workflow solution for diabetes clinics. So it's encouraging to see that they are branding their products this way. Further, we go to the sort of the last section really of this very quick overview of Mocero Health. There are certain questions which I believe the customers of Mocero Health may have, hospitals or clinics and individual care providers may have. Say, for example, there's a lot that is happening here. It's difficult to digest. There's one tech company offering such a wide breadth. All this data, it's valuable data, that is at in possession of Mocero Health. So clearly providers would ask this question about data security. Now, HIPAA, on the website, it's mentioned that they are HIPAA compliant, but I believe the industry globally is moving much ahead. Things like SOC 2 or in picture. So probably would want more clarity on the data security. There's not much mention, at least on the website or elsewhere in the social media, about the testimonials. How what are customers of Mocero Health talking about, saying about the services, how their experience has been. So it would give a lot of confidence to new healthcare providers who are approaching Mocero Health. There's one aspect. I mean, Typically when you look at the advanced economies like, say for example, US, that have been sort of, they're still getting digitized, but largely for the past about 2 decades, this digitization process has been there. And increasingly you see, at least on the social media, as well as if you, speak with providers in the US, there's a lot of pain. There's what they call provider burnout because of all this technology. It's either not seamless, and there are multiple issues. As I previously mentioned, there's so much data entry that, the clinician spends more time looking at his or her screen than the patient. So there's a lot of burnout, stress, eventually affecting the delivery of care. So it would be interesting for a startup like Mocero Health, whether they can learn from, the lessons from the advanced or developed economies, and try to see if they can get it right in the first go. All right, that's really about it. There was a lot to cover in this video. So looks like Mocero Health, they're claiming they have automated workflows for more than 40 specialties. Now, believe me, that really requires good in-depth understanding of each specialties, and looks like Mocero Health have done their homework right. We would be very happy to host the founders or the team of Mocero Health for a chat so that we can understand each of their features in much better detail. All right, so on this note, all the very best to the founders of Mocero Health. Ciao.